Everyday healthcare workers dedicate themselves to caring for others, but across the country, many are facing growing challenges that impact their well-being and their ability to stay in the field. Our problem statement was on managing staff engagement and staff burnout. Let's learn a little bit more about what this is.
Hey Josie.
Hey Shay.
Do you know anything about turnover and burnout?
Yeah, people experience burnout when they feel drained emotionally, mentally, and physically exhausted, usually from constant stress or overworking. It can make people feel unmotivated or like they just can't keep up anymore.
Oh yeah, and turnover is when employees leave their jobs and need to be replaced. High burnout often leads to higher turnover, especially in jobs that are really demanding, like healthcare.
Let's break down what the numbers say. As of 2024, 45% of U.S. physicians reported feeling burnt out. That's nearly 1 in 2 doctors. While this is an improvement from the 62.8% peak in 2021, it's still alarmingly high. Among nurses, the situation is even more severe. 62% reported feeling burnt out in 2024, with younger nurses most affected. Healthcare turnover is just as concerning. The National Hospital turnover rate was 18.3% in 2024. Burnout and turnover directly affect patient care. Studies show that burnout is linked to a 70% higher risk of patient safety incidents. Let's take a look at how this data plays out in real healthcare workers' lives.
We sent out a survey to the ultrasound department at Fredo to see their experience with employee burnout. What we found was that most employees expressed feeling overworked, struggling with work-life balance, and pressure to be constantly available outside of work. We also conducted interviews with some more healthcare workers at Freighter to further understand how they are affected by burnout and turnover in their profession.
When we encountered that time frame of COVID, we saw a lot of things happening in healthcare, people not wanting to be in healthcare, as well as, like the burnout like you guys are talking about. And our numbers slowly declined. So it was that whole initial COVID push of, heroes, healthcare people are heroes, right? That was like a big thing. And, everybody wanted to, do their part with it. And then you sort of started to see that fatigue. And then there was a little bit more concern about being in healthcare. We started to see people making a little bit more money because there was there's many different terms for it, but you could hear the term hero pay. And so people were making a lot more money, and so they decided I can work less and still make the same amount as before. Because what's happening right now is we have the same number of patients or more. I mean, we're seeing highest volumes we've ever seen, in our healthcare system with fewer number of employees. You can incentivize people to pick up if there's typically an incentive on top of it. Now, as we start to staff up and we get more people in, that slowly has been backing off, and we're kind of limiting some of those opportunities, but it's still there. A lot of people would pick it up and they would be real heavy, like make hay while the sun shines, right? Make that money while it's there to be made. But after a while, it takes a toll on you personally. That's where that burnout comes in. So after a while, even the incentive money isn't enough to bring people in because they're just physically and mentally strained from coming in and taking care of sick people all day long. And so honestly, if we can just staff up a little bit more, people are probably going to be a little bit more, satisfied with their job and, come into work and be happy at work. People would not come into work because it was so stressful. And if you can come into work and enjoy your day, it makes it a lot nicer.
Burnout in ultrasound, from a tech perspective, comes down to the work-life balance. It's if you're working too much, you're going to get stressed out. You can only work for so long. It's different for each person, and it kind of wears on you that you just never get away from work. And if you don't get away from work, you don't really have a work-life balance. You just have a work balance. You see sick people every day and people needing you, and you just want to be done. Ultrasound is a physical job. We're definitely more hands-on than some of the other imaging modalities. It takes a toll on your shoulder, your elbow, your wrist. Your body starts to break down. From cleaning our probes when I first started here, just simple. All I had to do was put it in the cleaner, pull it out, wipe it off, be done. Infection rate, 0. Now we have binders upon binders upon binders of stickers and log numbers and lot numbers and serial numbers that we have to write down every single time. And it isn't like serial number 1, 2, 3. It's like 18 digits long, and it's just insane because the government now wants it. So you give it to them, and it takes a 30-second process and makes it a 15-minute process. Adding on to that, it detracts from healthcare. I'm spending time doing paperwork when I could be working with another patient. That can also lead to burnout, because I didn't take this job to do paperwork. I took this job to work with people, not with with paperwork.
Factors that contribute to the high burnout and turnover rates we're seeing in healthcare today. One of the most common trends we saw while talking to the healthcare professionals about burnout was staffing shortages. One major reason is the growing population of patients, especially as the baby boomer generation ages and requires more care. This demand puts even more pressure on the already short-staffed system, making it harder for healthcare workers to keep up. The combination of heavy workloads, staffing shortages, and increasing patient needs continues to push many professionals to their limit. It's a trend that is constantly changing and affecting our healthcare system.
Another thing that really stood out in our conversation was how much healthcare workers are spending on computers, sometimes even more than they spend with their actual patients. A lot of them said it feels like they're glued to their screens, constantly charting, entering data, and trying to keep up with documentation. While all of that is important, it takes away from what most of them went into healthcare to do, care for people.
Yeah, I can see how that can be really draining. Instead of connecting with patients, they're stuck doing paperwork that administrators are enforcing. That kind of disconnect can make the job feel less meaningful and way more stressful.
Yeah, so even though the computer work is necessary, it becomes a huge part of why so many healthcare professionals are feeling stretched thin and worn out.
I wonder what can be done about this.
At Freighter, steps are being taken at both the organizational and department levels to support staff and reduce the impacts of burnout. With Freighter and the Medical College of Wisconsin launched the SOS Peer Support Program. This initiative ensures that every staff member has access to trained peer supporters when facing stress, trauma, or emotional fatigue. It's been especially helpful for those who are emotionally impacted after adverse patient events. The hospital has also partnered with Spring Health to offer a set number of free therapy sessions for staff and their families through the Employee Assist Program. This also improved accessibility to mental health care and created a more supportive environment for both clinical and non-clinical.
There are several meaningful ways to address burnout in healthcare. First, reducing the administrative force can make a big impact. This includes simplifying electronic health records, cutting down on unnecessary paperwork, and using tools to help with documentation so providers can focus more on patient care.
Promoting open communication is also essential. Creating a supportive environment where staff feel comfortable voicing concerns and where leadership actually listens and responds can build trust and boost morale.
Looking ahead, investing in the future healthcare workforce by educating and inspiring high school students to consider careers in the field can help address long-term shortages.
And of course, fair compensation matters. And offering competitive pay, retention bonuses, and student loan repayment programs can help retain dedicated employees and show that their hard work truly matters.
Even though we weren't able to find a clear solution to burnout, our goal was to better understand the issue and bring more attention to how it's affecting healthcare workers across the country. Burnout and turnover may not have an easy fix, but by sharing these stories and raising awareness, we hope to spark change to support our healthcare workers.